This is Dr. Kanaan, and today we will talk about the 4 new pliers that iOS has introduced to be used with clear aligners or Invisalign. Today I will talk about the horizontal plier. The second plier would be the vertical plier. Then we will have the hole punch plier. And finally the teardrop plier. And I will show you how to use them on some trays that I made them to be used with a typodont, since we don't have an actual patient today. So let's get started. So we will start with the hole punch plier, and this is very useful. Let's say you have a patient who you finish or who is in treatment, and then you have a class 2 like this one or class 3, and then you want the patient to wear rubber bands. Okay, so you can use it with hooks, or you can add physical tube at the bottom. Here in this model, an example, we added a tube and a button, but now if you want to fit the tray, it will hit here. So to fix this one, we need to cut a hole. We don't want to waste our time with the high speed, so I will go like this. The plier is half out, half in. Now let's see if we cut it enough. I need to cut a little bit more, no problem, very easy. I'll go more like this. Excellent. Now I have the button. Now I need to cut on the lower one to accommodate the tube. Same concept. This is the first molar, half in, half out. If you go and cut it all the way up, then you will have a whole circle and it doesn't go in. So always cut half to provide some clearance for the tube. It's good. Yes. Okay. And then I'm going to check. We need to cut a little bit more. And see, this is a nice, I can adjust it very nice. You watch, excellent, excellent. Maybe a little bit more. Watch how it's doing. See, very nice cutout. Put it in, and you can see now this tray fits. This tray fits here. I will show you on the other side. I have a case here for class 3. See how the tray doesn't fit? So I go very easily half away, and this is where I got. Now we may need to cut a little bit more. Let's see. You see it now, beautiful. See? Same thing, I'm going to cut this one, the upper left. I made here 2 examples, one for class 2, one for class 3. Okay. Cut more, cut more. Beautiful. Now the patient can go and you ask him to wear rubber bands. I like to use like maybe 3/16 medium. Okay. Here we go. Very simple. Okay. Now let's assume that you don't want to go ahead and put a button, okay? Or you don't have a button, or you're in a hurry. What you can do now the second type of plier, which is the teardrop plier. Let me pick it up. And this is the teardrop plier. And how it works, let me take the band off. let's say we want to put a hook right here for the canine. So the way how you do it, you go where the canine is, 2/3 of the plier is inside and 1/3 is outside. And you go a little bit tilted, so you add some retention to the elastic, punch in, that's it. You got a nice cut. If you want to add a retention groove to it, you can add something like this. Very simple, see, very simple one. And then now the patient can use it for the bands. Now, where is the button here? We don't have a button for the lower right 6. No problem, we're in a hurry. I use this one, again tilted. See, I got a hook. If you give it more retention groove, you can cut a little bit forward. Very nice, beautiful. And then the patient can also use a tray. See? Okay, and then this is how the patient can work. I don't like this technique too much because sometimes these bands, they have the tendency to lift up the trays. So you have to use some lighter forces, maybe like 1/4. But you can use also, if they tend to be lift up, use the vertical plier to add some punches in between the teeth, some dents, and this will add extra force and stability for the tray, so the tray won't come up. Another trick that you can use the teardrop with is, let's assume that this canine is up. Okay, let's say that this canine is up and you want to bring this canine down. Is you focusing?
Yes.
So what I want to do, I want to put a band like here, okay, to pull this canine down. So I will put a band like this to pull the canine down. But how can I hook it? There's nothing to hook it against here. So what we will do, we're going to make 2 grooves here inside of the canine tray, so you can hook the bands on with. Very simple. We'll make 2 here, so it's going to be put a little bit tilted. 1, 2, it's over. And then the way how we do it, you ask the patient first to put the bands on this, okay, from inside. Patient will put the tray on, and then you go to the bottom, over. So you see the band going from the lingual of the tray to the canine that's up, and it's trying to pull this canine down. Okay? So these are the 2 major uses for the teardrop plier. So now we will talk about that horizontal plier. So in Invisalign, if you have a power ridge, you can see a power ridge here. This power ridge will give you what? It will give you a lingual root torque, correct? So let's say if you want to add more, very simple. You go like this, push more, and you have it a little bit bigger. And iOS, they consider the thickness of the teeth. This is very smart where they added the bevel right here. You can notice that how the plier will go all the way in, okay? So even if you want to put one horizontal tip right there, you still can do it. Very nice one, okay? You can put them on the facial, you can put it on the lingual, okay? You can put it on upper and even the lower. Watch even the lower with this narrow one. Watch how much this head will go all the way. See, this is going all the way to the top because of this unique design tip. All the way to the top. Excellent, excellent. This will tip this crown a little bit to the lingual. Now, if you have trays that are not snug or tight enough, you can use the vertical plier. And the way how I use the vertical plier is, you go in between the teeth and just make a little dimple. Okay, put a little dimple here, put a little dimple there, and then this will add retention. Okay, now if I have rotations issue, like let's say the upper left central is rotated a little bit more to the facial out and I want to kick it inward, very simple. I go to the distal, okay, just put a small bend. So this bend will make the distal corner of the central to go inward. Okay, so this is the second use for this plier. Another usage for the vertical plier, let's say you have a small diastema, very small diastema between the upper centrals, and you want to push them together. So what I would do, I would put a bump between the upper right one, upper right two, another bump between upper left one and upper left two. So we'll put the bump, one here, another one right here, and I will also add one from the lingual, add another one from the lingual, and this will help to put these centrals back in their place and close the gap. These pliers, you can use them with Invisalign, you can use them with a Housemate, Clear Correct, the one from 3M, Spark. They're compatible with most materials. I wouldn't recommend them to adjust a night guard because the night guard material is thicker. Yep, see here we're trying to cut Invisalign and it's beautifully done. Thank you for watching this video. I wish this was helpful for you and you have learned something new. Again, these are a must-have pliers in your office if you're doing in-house Invisalign, in-house clear aligners, or you're using any of the trays as retainers or active treatment. If you have any questions, you can email us. If you have any suggestions on how to use these pliers in a better way or how to enhance them, you are more than welcome to send us your suggestions and then we'll consider them seriously. Thank you so much again.